I think before the project start, I think CRVS is not functioning in the Solomon Island. I think the CRVS office just starting in 2010, and there's no data on CRVS since I think before 2010.
I think there were people in the Solomon Islands who would have valued that information, but because the information was, you say, not really there before 2010 and very incomplete after that, it wasn't being routinely used in planning because it wasn't available. That's very difficult, particularly if you have not much data from each province and you have to come up with a budget and a plan. The Solomon Islands is lots of small islands with small population, are very, very difficult to travel between islands, infrequent flights, and within a province a lot of the travel is by boat. So in terms of delivering data from the peripheral facilities to the central facility, that's extremely difficult. It takes a long time. It's very easy for the data to get blocked or lost because of bad weather or lack of fuel. So that's been one big challenge that has faced the Solomon Islands for all of the health data. And maybe the second big challenge is even at the central level, HAS office is a small office and they're very busy. So that means that there's many responsibilities on the shoulders of a few people who have to be experts in everything.
Yeah, so human resources are main challenge.
First, we have to form the mortality committee just to oversee the progress of the activity, and I think get the push from the head of the ministry to the provincial level. And first we implement the what we call MCCOD and death notification. After we roll out the death notification and medical certification of causes of death, and we move on to verbal autopsy. In 2017, I think that's the first time we put the top 10 causes of death in the media, in the newspaper. And I think that's the time that the head of the ministry and I think Home Affairs see that we have the data and the top 10 causes of death, and they're starting to support the CRVS work in Solomon Island. We already witnessed that so many of people in Solomon Island have died of NCD, but didn't really have the data to verify that claim or ideas of NCD that kills people in Solomon Island. But when we get the information, the VA data from all the VA interviewer, and we have support from Melbourne University to analyze the data and say it with us, and we show that yes, true, NCD is a problem here in our country.
But even though NCDs are a problem, the other thing that it shows is that the communicable diseases have not gone yet. And particularly outside of Honiara, in many of the other provinces, things like pneumonia and diarrhea are still common. And so that kind of shows us that double burden of disease in a way that's really powerful.
And I think we have few malaria deaths, which is not expected. I think on the VA data we saw few malaria deaths. We are working on the eradication of malaria, but when you have malaria deaths on the analysis, and that's something that I think the Ministry of Health need to look on it and investigate more. One of the big issues we have in a country is the MCCO dividend, and even we hardly capture any maternal death. When you look at the data, MCOD data coming from the province as well, you will never notice like any maternal death reported from the MCCOD data. But when I look at the VA data, and I saw that few maternal death is captured on the VA data, and that's, I think, a success for us to capture few maternal death from the provinces. I think one of the thing we're pushing in is just to, because I think the CRVS legislation is out of date, and I think there's no detailed information on the legislation about the causes of death and how, and put who's to certify the deaths in the hospital and in the smaller health facility. So I think it's good that Solomon Islands should have a good legislation, CRVS legislation, that stated all the responsibility and all the CRVS work to, it's stated clear in the legislation. So I think at the moment is like, when you try to push the doctors or the nurses to do verbal autopsy or to certify death in the hospital, I think there's no clear law that guide that one. The doctor the responsibility is to certify all the deaths that happen in the hospital, and for the nurses to go and follow up on the deaths that's happening in the villages or home deaths.
One thing that I think has been very good, and this has been part of how D4H has been working with pre-existing programs, is DHIS2 came into operation in the Solomons in parallel, more or less, with D4H's initiative. And one of the things that has been good to see is that platform can be used for provinces to look at their own data, as well as just, so you don't just get data at the national level, but at the provincial level. And now we're working to feed in the individual death data that we have into that system, so that even at the provincial level people can look up their own data and analyse it themselves. So that's something that we're looking forward to seeing coming. One thing which is common in VA data in many countries was, again, surprising to me, was that the VA data from our facilities, particularly because we use VAs to do death on arrivals, there are many more men than there are women, and that's because men are more likely to be brought to a facility for treatment, because it's very expensive and difficult to do it, and in many countries it's often the male, because they're the income earner, is prioritised for hospital treatment, because if they die, the whole family is put into poverty. So one of the things I hope that our VA will do as we get more community deaths is that we'll see more of the women's causes of mortality, and because the national statistics mostly are about men, not about women.
Yeah, I think there also, we see it on the MCOD database that there's a lot of male and female. But I think when you look at the VA data, we get like not very difference between the proportion of,
it's much closer.
Merely much closer.
Yeah.
When we look at the VA data, it's much closer, not like the MCCOD.
And previously, if there was CRVS data about individuals, the cause of death, it was almost all from Honiara. So again, now we're getting much more from the provinces than we had before, and so instead of the national statistics being dominated by what's happening in Honiara, we can say, okay, now Western Province is represented, Malata is represented, we see the cause of death here, it's coming from everywhere, not just from one hospital in one place.